It's 12:04 in the afternoon here on 90.3 FM. It's Wednesday, which means it's Helping Seniors Brevard Day, and with that very special show today, here is none other than your host, Joe Steckler. Good afternoon, Joe.
Good afternoon, John, and thank you, listeners, for being with us today. Excuse me, I'm going to cough. I did it. That's a good thing. Talk radio. You can hear me, but you can't see me. Anyway, I got everybody laughing, so it's, I've been doing this with the guy that's with me today for roughly 19 years, and that's a long time. And the purpose of helping seniors is to inform, educate, and connect seniors and those that care for seniors with help. But we get a lot of calls for people that need other information too, and so we're just as happy to do that because what we do is I think, do a pretty good job of connecting people to resources. And my panelist this morning is Bill Johnson. Bill is an elder law attorney. Welcome, Bill.
Thank you, Joe. Welcome.
Oh, thank you. And, I asked Bill to give me some thoughts on what he wanted to do for a show today. And I really would like for you to get a pencil and paper while I read a couple of things to you because I think it's important. Bill's an elder law attorney, but here are the main topics that Bill thought about that we could put together for a show. And we titled this thing, How to Find Help. In the process of trying to find help, we have to identify the problem. We have to find the right person to answer the issue. We have to get educated on what this is all about. We have to develop a plan of action. And we have to see then about getting results. But the plan of action is something that Bill, you and I have talked about this for many, many years. And at one time we had you and a guy named Scott Glover who was a financial person, and Mike Sofka from Dignity Memorial Funeral Homes at the time. And we sort of thought that was our three-legged stool. That
I think you're off by one group.
Well,
I didn't start with them.
Well, we had a three-legged stool and a four-legged stool. What was the fourth? Why do you want to start with?
Well, no, I started on air with Kara Anderson and Robin Adams.
Oh, okay. I see what you're saying. Okay.
Yeah.
Well, and it's funny you mentioned that because I've got to get a hold of Kara because I got a problem that I don't think the Kara's the only one that can solve it right now. So I got to get a hold of her today, too. But talking about what we do, the sponsors for this radio show, you've been a sponsor of our program for a long time because you are an elder law attorney and you know the importance of getting information out to people. But let's just talk about the first part of the problem, identifying the problem. And I'll let you go ahead and talk about that.
Well, what I meant by that is a lot of people have issues, but they don't really know what kind of issue it is.
Right.
For example, somebody has a stroke, they're in the hospital, somebody at the hospital tells you, the doctor says, well, you're going to have to take mom home and she's going to need 24/7 care. Well, what kind of issues do you got right there? Well, you got a bunch of issues.
You're right.
You got, the first one is, who's going to provide the care? We want to make sure that not only is mom getting care, but she's getting good care. And who's going to help you figure that out? You got some issues on the financial end. How are we going to pay for this? You may have some legal issues. Is mom capable of making her own decisions? Do we need a power of attorney, a healthcare surrogate, or does she have those already? Who's going to assist mom with this problem? And so you could have all in one little long-term care event, a financial issue, a legal issue, and a medical issue.
And you had to pick stroke as the one topic because you know that I had a stroke. And as in the process of working my way through the stroke, I had somebody very close to me that was very capable and was able to care for me, my wife. I was fortunate. Thanks to you, I had a trust in place. I had all the documents I needed, so I wasn't concerned about that. My big problem was what effect was the stroke going to have on me? Luckily, I got to the hospital in time, and I got through the hospital and into the rehab place, and I came out of it fine. But I didn't have the worries that you just talked about, so maybe we could just talk about that just for a minute.
Well, if you have an issue with long-term care and you're faced with, a legal, financial, and medical problem, who's going to tell you about that? Who's going to be the proper person to dissect that and basically triage it so that you know that you're going to the right places to deal with all these different issues? And that brings, the second point up is who is the right person to triage it and who is the right person to answer those issues. And I put together a little list of potential people who could be helpful. Of course, one of them being Helping Seniors of Brevard.
Right.
I mean, that's what our organization does. So, people call, you guys answer the phone, they go through this list of things that have happened, and then you have to basically triage it and figure out where the appropriate place is where they can get answers to those questions.
And that's really that's something that we need to talk about just a second, because invariably people, when I'm on the phone as acting as the education specialist and I get a phone call, I talk to the people and they tell me what they think the problem is, and that's probably the problem, but most of the time they don't always have all the answers to what some of the solutions are. And since we have 75,000 veterans in this county, that's a lot of people. And then I start thinking about all the people that are spouses of veterans. And just yesterday, I had another phone call. A woman did not realize that she is eligible for Veterans Aid and Attendance. She's living on roughly $1,700, $1,600 a month. She's eligible for probably another $1,100 a month.
Well, that's a perfect example of a multifaceted problem, because you have a veterans issue. You know that you can go to the county, and there is a Veterans Service Office in Brevard County out in Building B. Each county in Florida has one. If you look up in the phone book under Brevard County, and those folks will assist you with that. However, in her case, she might also be eligible for Medicaid. She just might not know it, and the veterans folks might not know it. And so she might be eligible to get benefits at her house through another program. But nobody at the Veterans Office is going to be able to dissect that or tell her about her eligibility.
So you're talking here about getting into the Medicaid eligibility program.
Well, she could be eligible for it.
Right.
Yes. So but if the only stop you make is with the veterans folks, they're not wise to Medicaid.
That's right. And when you get somebody that thinks, oh gosh, the problem you just brought out here, that they think that they need long-term care, and they don't have long-term care insurance. And that's another problem. It's going to become more of an issue, and we'll talk about that in just a second. But what Bill's described, folks, I'll get him to talk a little bit more about it. But
so usually, especially with the long-term care event, the first line of triage is going to be the social worker, either the social worker at the hospital or the social worker associated with, like Dr. Visa's office and the aging center. So, one of the jobs, and I think social workers are very undervalued, is that they know all these resources.
That's right.
They know, and they can triage these things and get you sent in the right direction so that they can send you to the proper people to, provide home care or to provide a placement in assisted living or to the lawyer's office to help you get qualified for Medicaid or to the veterans office to get VA benefits. They are very good, and that's what they do. However, a lot of times they're very overwhelmed.
Well, they are, but, we're not going to know how overwhelmed we are or what we can avail ourselves of until we start making some inquiries.
Correct.
And, the phone number, folks, is 633-2012, 633-2012. And I tell all the people that call me and I find out that they need to talk to the VA office, I want them to call out there and I give them just a little guidance on what they should tell the VA team out there so that they can get started in the right direction. I always try to make sure that they tell the VA that they have the Veterans DD 214, which details the veteran's service, and most people do have these papers. They just don't realize sometimes that they do have them.
Correct. Now, there's another route you could go, and you could go ahead and hire an advocate for you in the health system, and those folks are called geriatric case managers. And this is where you pay somebody an hourly rate to coordinate your care between the doctors, the facilities, applying for public benefits, maybe paying your bills, maybe managing your health care, maybe managing your finances. But those people, their job is to know all the things that are available to you and how to bring those all to bear. They can also be a very, very strong advocate in the healthcare system because, as you know, oftentimes one hand doesn't talk to the other in the healthcare system, and if they're involved, they will get to the bottom of why that's occurring.
So Bill is making a case, folks, for, we try to, if we've got $25,000 in the bank, we try to hang on to it. If we got $100,000, we try to hang on to it. If we got $1 million, we try to hang on to it. Regardless of how much money you got in the bank, sometimes you got to part with a little bit of it to find out what you can avail yourself of and what you're eligible for. And it's like pound wise and penny foolish here. You could spend $300 or $400 and get some answers and make sure you're started in the right direction. Some people you don't know. In the care system, folks, what Bill and I are talking about, there are starting points, and you have to know some of the starting points. If you don't know what the starting points are, you need to talk to somebody that knows what they are so they can tell you what to do.
Correct. And a perfect example, well, next on my list, let me jump to the next one on my list.
Okay.
The next one on my list is somebody who can help you get the right answer would be an attorney. Typically, if it's going to be a long-term care kind of question or something dealing with seniors, you're going to want an elder law attorney. Estate planning attorneys know a lot as well. But a lot of times I get folks who come in and they want to inquire about VA benefits or Medicaid benefits for a loved one to help defray the costs of long-term care. And invariably, somebody will ask me, okay, well, what is the best facility? And I will respond, that's not my job. I'm a lawyer, not a doctor, not a social worker, not a nurse. There are so many facilities in Brevard County. There's something like 150 assisted living facilities right now. I couldn't tell you which ones are good, which ones are bad. I got a general idea of the really good ones, but that's only as good as management stays the same. If management changes, I can tell you, I've had a few experiences with nursing homes where they've been bought out, management changed, and everything went south very quickly. So at one point, they were a good place to refer to. The next time, they're not so good. And it's beyond the scope of what I do for a living for me to keep up with all that. And there are folks who do keep up with that. Those would be, again, your social workers and your geriatric care managers. You also would have to lump in there the placement agencies. There are a plethora of placement agencies. I think you've had at one time or another Rob Graham with Care Patrol on here.
Right.
You've also had Kara Anderson with Simplifying Senior Living. There are, I can tell you, there's probably another 10 at least that are out there right now that have what they do is they will help families tour and look at assisted living facilities. And basically it's their job to keep up with what are the good facilities, what are the ones who are delivering the good care, and when they help somebody, and you know, to make also a match for somebody. Somebody may have needs that cannot be met at one facility or another, and they would have to know which facilities are able to deliver those services. Now, all that is well beyond what I can tell somebody, so I don't get involved with that end of things. But that's a perfect example. You may go to the lawyer's office and I may tell you, yeah, this person will probably need to go to assisted living. And then invariably the clients will ask me which one, and I will defer.
Well, and at the same time, I get a lot of phone calls, and I got one this week that, it came in over the weekend, and I haven't had a chance to talk to the people. But essentially what they're looking at is living on a very, very limited income, and they know they're going to need assisted living care. And now how do we make this happen on an assisted, on a minimum income? It turns out this person is already receiving survivor's benefits, but she's also got into the Medicaid system already. She didn't realize exactly what her benefits are. Then it turned out that she's also eligible for veterans aid and attendance. And once you get a geriatric case manager or somebody that knows the system and knows how to work the system and make it work for you, they can take the knowledge of the income that you have available, and sometimes, or most times, they can make the pieces fit so that you get the care you needed, but it's not free. You've got to realize that some of the assets that you have, the monies you get, are going to go into paying for the care.
Well, that brings up my next three people that may be helpful.
Okay.
And if you don't have long-term care insurance, or you're late to the game, or you have questions about your long-term care insurance, or how you're going to pay for care, the three financial folks I have on my list are your accountant, your financial advisor, / broker, and your insurance agent. Accountants, I'll take, let's say perhaps you have a different kind of problem. You're worried about mom or dad, and all of a sudden the accountant has informed you that they were doing the taxes and reviewing the accounts, and dad gave away $100,000 to some charity in Afghanistan that he's never heard of. The accountant may be there and the one to help you solve that problem and get you directed in the right place. I've had occasion with several accountants who have been the first ones to detect an exploitation case. Financial advisors, as you were talking about, finding ways to pay for care, it's got to come out of what pot? Is it going to come out of the IRA? Is it going to come out of this brokerage account? Is it going to come out of the CD? What pot of money are we going to use? Can we generate enough money to pay for this care? Plus room and board and things like that. What is our burn rate? How long do we have before we run out of money? Additionally, insurance agents could be involved in this. If you have a long-term care policy, when does it take effect? If you're interested in a long-term care policy and what all the different conditions are. So you can have these financial folks being the initial point of contact as well. And of course, they, again, if you go to the financial advisor, one of the first things you say, mom had the stroke, and of course the financial advisor goes, well, does she have a power of attorney? They may be the one referring out to the attorney or to a placement agency or something like that.
And let's go back to something you mentioned this several times. We're talking about long-term health care. I hate to admit it, that long-term health care I'm beginning to see a more rapid decline in the availability of these plans than I've ever seen before. Several years ago, we had over 120 companies that offered long-term health care. The last time I looked, it was less or fewer than 20 companies that provided long-term health care.
Yeah, the biggest one that was left, Genworth, just got out of the market.
Is what?
Genworth. They were the biggest one that was left, and now they're out of the market as well.
Well, that's something that I've gotten several calls, and it's not to put the fear factor into anybody, but if you do have a long-term health care policy, I strongly advise you to talk to your financial advisor or an attorney about the wording in your long-term health care policy. And the reason I say this is because I have been paying into long-term health care for my wife and I for roughly 20 years. It's not cheap. We just got a notice in the mail that the cost of one of our policies is going to go up roughly $500 a year. And that's the biggest increase I've seen in the time that we've had these policies. Moreover, there's an indication that these might be yearly increases. So what I'm saying to you, you holders of long-term health care policies, when you get something about your long-term health care, please do not ignore that piece of paper and read it carefully. I read mine carefully 3 times, and I know now that I'm going to talk to the Shine people because I'm not quite certain exactly what the wording is saying in the policy. Now,
hold on, back up there.
Okay.
You got to tell people what Shine is.
Okay. Shine is an organization titled Serving the Health Insurance Needs of Florida's Elders. And they are a free organization that are paid for by the federal government. There's one organization in every state, the United States, and each state gets roughly $1 million to pay for this. And right now there is part of the president's budget that will reduce some of the money for this program. And here in Broward County, they get roughly $10,000 a year, and they save people millions, and they get people peace of mind. They help people. We got a minute to go, and we're going to talk about this more after the break because we've opened a Pandora's box about long-term health care, and we're going to talk about that a little bit. But it's just something that you can't ignore the mail. You have to read these things, Bill.
Right. I agree.
Yeah.
I got a little comment about long-term health care, too. So.
Okay. We'll go ahead and take a break, and then we'll come back. I'll let Bill talk about his comment, and then I will talk about mine because it is extremely important that we do pay attention to long-term health care issues and policies. We're going to take a break now. Stay with us.
12:34 in the afternoon. Now more of Helping Seniors of Brevard and your host, Joe Steckler. Joe?
Thank you, John. You know, folks, today's show, my panelist is Bill Johnson, elder law attorney, and Bill's been with me on the radio show for roughly 19 years. So I've known the man that long. He's an attorney. He's managed a lot of things for me, so I have personal knowledge of what he does, how he does his business. And, you know, sometimes, like, helping seniors, our job is to help seniors get the right kind of information, be well informed, try to do the very best we can to get information out to people. And folks, I had a lady call me the other day, and I said, how in the world did you find out about me? And the lady was calling from Pennsylvania. She found our site on the internet. Her mother lives in Lake County. She's 88 years old. I listened to a long time of problems that the women are having and dealing with problems. And here it is, a woman from Pennsylvania is calling us in Brevard County about a problem in Lake County. You know, we're going to see more and more of this, folks. There are organizations that people start seeing. I asked her, how did you find out about us? She said, well, I saw one of your television shows on YouTube, and you were talking about the very thing that I needed information about for my mother, so that's why I called you. So I gave her my word I would do some more investigating to see if there's possibly some way we could help her. And a lot of it involves putting together what Bill and I are talking about. But the one thing I've never wanted to do, folks, is to make this radio show a scare tactic show. But I am very, very concerned right now, myself, Bill, about long-term health care insurance and what's going to happen in our country. And you just showed me something on your cell phone, and I want you to talk to people about what you showed me. But long-term health care insurance is a good thing. But if the companies continue to go out of business at the rate they're going out of, and they keep increasing the prices where only the rich could afford it, if actually the rich aren't the ones that needed long-term health care insurance. It's the people that can't afford to pay for care. And
I'll jump right in on that.
Go ahead.
Because that's what the article talks about. There was a study done, and it talked about in the next 10 years how half of middle-income earning seniors will not have enough money to pay for housing and care. And what they're referring to is, obviously, if you're low income, there are programs out there that you can apply to and get help. And if you're high earning, you just self-insure. So there's going to be this squeeze on the people in the middle because there are no programs to assist them. And it was looking at people's incomes, and the average, or at least half of seniors, have less than $60,000 of equity, and that includes the equity in their house. And that simply is not even enough today to pay for an assisted living facility. So there is going to be a big squeeze, and there will be a lot of people who are unable to afford senior housing or senior care.
So what happens now, Bill, is a lot of those people that we're talking about are forced to go into nursing homes because the state has an obligation, and the way they honor that obligation is to put somebody in a nursing home, which costs 2 and 3 times as much as assisted living costs. So we're right away causing the state to pay a higher cost for care than it would be if we used our heads and started figuring out what are some of the...
I will tell you, the state, this legislative session has, I believe, is forming a task force of a lot of individuals to look at the affordability of assisted living facilities. And what they're looking for is a way to create low income housing, assisted living facilities that people can afford. Because the cost of assisted living facilities, just like everything else, has gone up over the years. And so subsequently, not that many people can afford it.
Yeah, I had a woman call me, and she has a house. It's a very nice house. It's located down in Palm Bay. And she was looking, I don't know if I had a couple of people, seniors, that might want to live together, and, a couple of people that would share the cost of the house. And she is willing to rent this at a cost of $800 a month. Well, when you start saying $800 is a lot, you go out and try to find a place to rent now for $800. That's extremely difficult. This low-income housing is just almost a word thing. It almost doesn't exist.
You are correct. It's very limited, and I believe the reason the state was forming the task force would be a way to incentivize folks like developers to make low-income assisted living. There are programs out there that will create or incentivize developers to make just low-income housing, but that's not enough when you have to deal with healthcare needs as well. And there are no programs out there that incentivize folks to create low-income assisted livings.
Bill, about 2 months ago, I had Barbara McIntyre on this radio show, on this station, and we talked about a project called Project Elmore. Project Elmore was a program that is designed to provide up to $50,000 of assistance in paying down costs for if you have trouble with your reverse mortgage, and they'll pay the insurance off, and they'll pay a couple other things off at no charge. It's free money. Yesterday, I learned that Project Elmore is going out of business in June. So if anybody wants to take advantage of this, it's got to be before June. Now, why are these programs going out of business so fast? Sometimes I wonder, Bill, what the heck our legislators really do both at the state level and at the local level. Here we are at the local level. We've got a budget of $1.3 billion here in Brevard County, Florida. We have taken almost every incentive we've got away from helping people. We talk about roads. We talk about the lagoon. We talk about we're taking care of fish. We don't want to kill the fish and everything else. But how about killing people? I'm not saying you got to give, but you have hit on the thing. We've got to figure out a way to develop a program. We need a plan now so that we can start putting that plan in place so that we can do what. Did you give those people those numbers off of that? Well,
I was just going to say the governor's budget talks about cutting $138 million out of the Medicaid budget for nursing homes.
I know.
So we're going the opposite way.
We're taking the ability to care for people away.
Correct.
So how do we, I just had an article in Hometown News that talked about the value of newspapers. Here we are, the only really, quote, newspaper, and that's not that much of a newspaper anymore, is Florida Today, serving Brevard County, but the local news section has almost gone away, and we don't really have a vehicle for making the real needs of seniors and people in general available.
Well, let's take that and get back on our outline here.
Okay.
Because the next step, besides finding the people to help you make the decision, is getting yourself educated. And certainly one of those ways is to read.
Yep.
And you know that we publish information in the Hometown News. There is Senior Scene magazine, where there is lots of information that is published. There's a competing publication, Senior Life, that has a lot of good information in it as well. They also publish the Boomer Guide, which is a listing of all the facilities and resources available in Brevard County, which is fantastic. They also, in those publications, list seminars where you can go and hear people like attorneys and geriatric case managers and social workers and financial advisors and insurance agents talk about all these different topics. There are also conferences out there. The Health First Caregiver Conference was just recently, and
Right.
we were there as an advertiser, but that's a wonderful way to go see a lot of different businesses and hear speakers on different activities. Also, you can research a lot of this, but I'll give you a caveat.
I'm going to have
Typically, your Google search will not be as good as my law degree.
What?
Your Google search will not be as good as my law degree. So I get people all the time that come in, we Google search this, and this is how Medicaid works. And I said, well, that would be great, except the article you read is from Kansas, and that's not how it works in Florida. So you have to be very particular on what you're researching and how you're researching it. But I do have a lot of people who come in with who have thoroughly researched different topics and are very knowledgeable. And, of course, the other way of getting educated is meeting with all these folks, meeting with the social workers, the doctors, the geriatric case managers, the attorneys, accountants, financial advisors, and, coming in. I, for one, and I know a lot of elder law attorneys do not charge for a consultation. So you can come in and talk to us for free. There are certain ones that do, but generally speaking, you can come in, you can talk, and generally we'll give you an idea what your issue is, or if it's not even the right issue to talk to me about, I can steer you to the right people to address your issue.
You mentioned seminars, and let's just take Brevard County, Florida, just as an example. We got, say, roughly 600,000 people live here now in Brevard County. Of those 600,000, what number or percentage of those people do you think actually go to seminars or even consider would even want to go to a seminar?
I don't really know because it's very localized. So I'm typically doing the Vieira Suntree area. Other people are doing in Melbourne and points out on the beaches and Titusville.
My point, Bill, is it's this. The people that attend these seminars, generally speaking, are the people that have planned and have put aside or figured out a way they're going to theoretically pay for their care as they age.
Well, it depends on what kind of seminar they're going to. If they're coming to me, my seminar is all about Medicaid. They either couldn't afford long-term care insurance or couldn't qualify, or they have an immediate need. They're a parent or a brother or other sibling has is in a nursing home and they need to find out how are we going to pay for this.
I'm still. I don't feel that we're really connecting on something, and I'm trying very hard to. People that can afford care are the ones that generally go to these seminars, and they want to be better informed. The people that you and I talked about, you mentioned a number, roughly. The majority of people probably have the majority of people make roughly $2,000 income per month. That's probably
retired out of Social Security.
Retired people on Social Security. And they really haven't. You know, I heard somebody say, well, you need to put at least have $1 million set aside in order to pay for all your issues and everything else as you age.
Well, they said, at least the numbers I read, is at least $1 million for retirement, and you should have, and the number just went up, but something like $300,000 set aside to cover your health care costs.
And how many people do you really think, Bill? You're an elder law attorney. How many people that talk to you? How many people do you think are actually have done that kind of planning?
Not many.
Not many. You're doggone right. Not many.
Nope.
So,
including the list of people I told you to go seek advice from.
I know, and it goes back to this business. Like I write for Hometown News. I had an article in there last Friday that talked about the value of newspapers. And newspapers are extremely important. They're probably the best mechanism we have for getting information out to seniors. A lot of seniors like to read a newspaper, but they can't afford. People living on fixed income can't afford Florida Day. I think the cost of Florida Day is roughly $68 a month now.
Yes, it's people are going without medicine. So the last thing they're worried about is the newspaper.
Right. So if they're not reading the newspaper, if we don't have, we reach a certain number of people on our radio network. We're trying to get more people to spread the word and listen to this radio show at noon every Wednesday so that you can be better informed about what people like Joe and Bill are talking about today. These are extremely important things that people need to think about. But the time to start this planning is when you're in your 20s and 30s, not when you're 60s and 70s and you're out of money.
Correct. One thing that really put a damper on a lot of people, at least in my generation, was the Great Recession. I mean, people had to dive into their 401ks and IRAs to come up with money to pay mortgages and help kids out. And I mean, that put a real damper on people's retirement assets. Or they, were unemployed themselves. And that really put a hurt on a lot of people's investments. And once, you start using that while you're in your 40s, 50s, you can't get back that miracle of compounding interest or the stock market.
When you take a look at what we're talking about, Bill, and you got 5 elected commissioners that serve their constituents in Brevard County, Florida, we are not a poor county. This county does have money. This county could probably do a better job of planning for the future. And I'm not saying that seniors need to be given free care or free this or free that or anything. I'm speaking, but I'm saying that we should be able to do a better job with our elected officials planning for the future. There's just no way we're going to get around the fact that we are going to have to develop something that will help people. And it disturbs me because I know that there are so many foundations in this country that give millions and millions of dollars away. And you think about some of the things they give it to. I have researched this for 35 or 40 years, and I have seen so much money wasted, squandered, and where it could have been used to help somebody, we just don't seem to be able to figure out what we really need for the future. And if we don't do it now, you've talked about all these things there. We talked about financial, we talked about legal, we talked about Medicaid, we talked about social workers, we talked about attorneys, counties, financial advisors, where to go to get information, seminars, conferences, and research. But the most important thing here is what you're talking about is getting educated. And that's probably one of the things we're doing the poorest job of, is getting educated.
I would agree.
Yeah. And we're not even, I can't believe.
I think we did that. I don't know the numbers, but one day we were thinking about just based on the demographics of Brevard County, how many seniors are out there, like how many people we actually touch compared to the pool of potential people who know that. And it's a fraction.
It is a fraction, but I'm going to tell you that last week, of course, we had the car raffle. And by the way, I want to thank all of you that participated in the car raffle because it's the most successful fundraising event helping seniors.
Did I win?
Pardon?
Did I win?
No, you didn't win.
Oh.
I'd have told you. I'd have got you into a decent car. I'm only kidding. I'm kidding. But now you got me so excited I forgot what I was talking about. That's terrible. Thank you, Bill.
You're welcome.
What was I
Anytime,
talking
Joe.
about? Oh, okay.
You were thanking all the sponsors of the event.
I was thanking the sponsors of the event, and I want to thank you for helping because it is through people like you folks that I'm asking you to go to your newspaper stand and at the post office and pick up a copy of Hometown News. You know, Hometown News is a good little newspaper, and there are 4 or 5 writers that do contribute to Hometown News that talk about local issues of great importance to the people in Brevard County. And they publish something like 79,000 copies of that, folks. Also, Senior Scene magazine. Bill is leafing through a copy of it here, and I'm just looking at, I see a story. One of the columns is a guy named August Belton, who is a financial advisor, and he's very good at doing what he does. Another is Lady Jennifer Helen, who's got a column in there about seniors helping seniors. And what's that other one there, Bill?
It is a vet.
Who's this?
Multisensory therapy for dementia.
Oh, okay.
With Chateau Madeline.
All right, there's a lot of, and then Barbara McIntyre's got a column in there about reverse mortgages, and there's a lot of things happening with reverse mortgages now, folks, that, you know, there's nothing that is going to stay at the status quo. Life changes. Systems of assistance, they change. New ones come online all the time. But if we don't do a better job of trying to educate ourselves, we're going to continue to be in trouble. We need to figure out how to be a better informed set of people here in this county.
I agree. I totally agree.
Yeah. So, you know, and all that we've talked about here, Bill, today, and, you know, it's easy to get emotional about this because, you know, like we're talking about long-term health care insurance. I had a man call me, he's 94 years old, and he said to me, Joe, he said, well, you think I should keep my health care insurance because they've offered me a buyout now because they're going to drop the program, but they offered me a buyout of roughly $12,000. They give that back to me. And he said I paid probably $100,000 into the program over the years. Insurance is a gamble, and we realize that. You shouldn't ever take insurance out on certain things unless you're willing to pay the cost.
Right. And why give it up for $12,000 when you already paid in $100,000?
Exactly right. But if the cost goes up to where it is $6,000-$7,000 a year and you're living on a fixed income, you got to say, well, how much longer am I going to live?
We're seeing more and more people come in to me to talk about their long-term care policies.
You are?
Yeah, because they're all getting letters like you're talking about, where they're offering reduced benefits or in lieu of, you know, hiking the rates up.
Hey, we got a minute left. The one thing I want to make a comment on is that insurance companies they can go out of business without telling you any reason at all.
Usually they go into receivership if that happens, but then you get cents on the dollar. You don't get full dollar benefits.
Okay, I'll let you close out the show. What comment you want to say?
Well, let's talk about insurance companies. That's why you
Let's
should
go
always
real
go with A-rated insurance companies and certainly do the research. Just don't buy willy-nilly from anybody.
How do they do that? On the internet?
They're Moody's. Moody's rates insurance companies.
Okay. All right. Okay, folks, I want to thank Bill for being with us on the radio today. And as I make the plea every time, think about being part of our endowment to help others that are may need help a little bit more than you. $50 check. One lady gave us a $500 check. It all goes in the endowment. If you tell me that's where you want it to go, it goes there. That's the rule. That's it. So I want to thank you for being with us today, and be with us next week as we have more about helping seniors. Thank you very much. Bye-bye.